It helps to close gaps and reduce inequalities. Investing in resilient healthcare systems is vital for their recovery and preparation for the future. However, no single nation or organization can tackle the health challenges facing the Americas alone. We are the partner of choice to promote public health and the best resource to improve the quality of life in our communities. We provide coverage in all countries, management and supervision of projects at the regional and national level, knowledge and networks in all areas of healthcare, capacity to convene people, mechanisms of transparency, and experience with responding to emergencies. Building partnerships has been essential to improving healthcare in the region. Life expectancy has increased by 36 years. The mortality rate for children under 5 has been reduced by 67%. Hundreds of millions of people have been able to get vaccinated and obtain access to medicines. Smallpox, polio, rubella, and measles have been eradicated. Each of these achievements demonstrates what can be attained through collaboration. And yet, we still have much work to do. Many people's lives depend on us. Let us continue working together to bring health and hope to every corner of the Americas. The Pan American Health Organization. Health is the most precious resource we have and an engine of sustainable development. It helps to close gaps and reduce inequalities. Investing in resilient healthcare systems is vital for their recovery and preparation for the future. However, no single nation or organization can tackle the health challenges facing the Americas alone. We are the partner of choice to promote public health and the best resource to improve the quality of life in our communities. We provide coverage in all countries, management and supervision of projects at the regional and national level, knowledge and networks in all areas of healthcare, capacity to convene people, mechanisms of transparency, and experience with responding to emergencies. Building partnerships has been essential to improving healthcare in the region.
Good morning, everyone. Good morning to those here with us in present, as well as those joining us virtually. My name is Lou Valdez. I'm PAHO's Deputy Director. And I'm joined here today by PAHO's Director, Dr. Jarvis Barbosa, and our Assistant Director, Dr. Rhonda Seeley-Thomas. And we all welcome you to the Pan American Health Organization. A special warm welcome to Dr. Atul Gawande, USAID's Assistant Administrator for Global Health, and Michael Camilleri, AID's Acting Assistant Administrator of the Bureau for Latin America and the Caribbean. We also want to thank the team from AID's Office of Regional Sustainable Development in the LAC Bureau for their efforts to bring us together on several occasions this year. Indeed, we recently welcomed the USAID focal points from the Latin America and the Caribbean missions, and many of whom are joining us virtually today, along with our colleagues from PAHO's country offices across the region of the Americas. It is truly an honor to have both institutions here together to celebrate a partnership that has been a cornerstone of improving health in the Americas for 30 years. Each one of you have contributed to the countless achievements gained through our collective efforts. These include the elimination of devastating communicable diseases, the strengthening of primary health care and access to quality health services, the development of a fit-for-purpose health workforce, continuing to tackling inequities and inequality, the transformation of health informations and digital health, and preparedness and response to pandemics and natural disasters. And the list could go on. Yet our collective history stretches beyond 30 years. The United States was a founding member of the Pan American Health Organization, and it led the organization for its first 45 years through the Office of the U.S. Surgeon General. And the U.S. has been an unwavering supporter ever since. Together, we have continued to find innovative solutions to the region's most complex health challenges. And today, we celebrate these many successes that provide a solid foundation to advance our shared priorities. Our partnership is more crucial than ever before following the devastating impacts of COVID-19 in the Americas. Together, we supported the country's response to the COVID pandemic, scaling up capacity to prevent, detect, monitor, and control outbreaks while ensuring resilient health systems to care for COVID-19 patients and deliver essential health services to those in need. And this is just one of the examples of how we can leverage our organization's strengths and expertise to positively impact national and regional health outcomes. As countries continue to recover and rebuild and bring a renewed focus to global health security, PAHO and AID can refocus and recommit on current priorities while also identifying new areas of collaboration. This will require strong alignment of our public health efforts, shared leadership within and across countries, and an active exchange of information for better public health programs and initiatives. Together, AID and PAHO can maximize our impact to benefit the people that we serve in the Americas. Every expert and every resource dollar are essential to the collective efforts to ensure that no one is left behind. We look forward to a fruitful discussion, which will begin with the highly anticipated dialogue between our respective leadership, Drs. Jarvis Barbosa and Atul Gawande. But first, let me invite Michael Camilleri to share a few words with us. And again, all of us welcome you to the Pan American Health Organization. So Michael, over to you, please.
Thanks so much, Lou. Good morning, everyone. Buenos días, buen día. Enhorabuena a los argentinos. I'd really like to join Lou and welcome you all to this celebration of the 30-year partnership between USAID and PAHO to advance health across the Americas. We are meeting, of course, at a pivotal moment for the region as it works to rebuild from the COVID pandemic and address new emerging health challenges. So I'm looking forward to today's discussion about how we can build upon our collaboration to meet these growing and changing needs. It's an honor to be here today on behalf of USAID, of course, to be joined by my colleague, Dr. Atul Gawande, who will kick off a dialogue with Dr. Barbosa in just a few minutes. I know we're all looking forward to that. Also look forward to learning more about the achievements of this partnership and how we can build upon our collaboration to address emerging health challenges in the Americas moving forward. For those I haven't had the chance to meet before, I'm Michael Camilleri. I'm about 3 months in as the head of our LAC Bureau, Latin American Caribbean Bureau at USAID, after serving in other positions at the agency over the last few years. And in this role, I have the privilege of leading LAC's innovative approaches to advance human dignity in many ways across the Western Hemisphere. That includes our efforts to promote democratic values, to create a safer, more humane system for migration, to bring more jobs and opportunity to the region. But of course, all of that work is undermined if people don't have access to the health care that they need for themselves and for their families. Health is the backbone of strong, safe, democratic, and productive societies, the kinds of societies people across the globe want to live in. Advancing health outcomes, increasing global health security, and strengthening health systems is critical to bolstering citizens' and communities' abilities to actively engage in making their communities safer, better governed, and more resilient to climate change. We only have to look to the COVID-19 pandemic to understand the fundamental importance of public health as an enabling factor for other development endeavors. That understanding really is at the heart of USAID and PAHO's wide-ranging partnership. Over the last 3 decades, we have leveraged each organization's respective expertise and commitment to enhance health and well-being in the Americas. And when we do that, we can achieve incredible results. Together, we have eliminated malaria in Argentina, El Salvador, Paraguay, and Belize. We have eradicated river blindness in Colombia, Ecuador, Mexico, and Guatemala. And during the pandemic, we collaborated across 20 countries to support the COVID-19 response and achieve over 70% COVID-19 vaccination coverage across the Americas. But COVID hit Latin America and the Caribbean particularly hard. As you all know, the region accounts for just 8% of the world's population, but some 30% of COVID-related mortality. Those losses and the long-term impact the pandemic had on health and health systems and our broader development goals are still being felt deeply across the hemisphere. That makes our partnership more important than ever. We will need to work together to rebuild health systems to ensure they are ready to prevent and respond to future public health threats and to tackle critical health inequities in the region among the most vulnerable populations. We will also need to continue collaborating to take on other global challenges that are hitting the region especially hard, especially the impact of climate change on health. We have already seen climate change contribute to the region's most severe dengue epidemic in the Americas, as cases have increased 304% over the last year. We were just discussing this with Dr. Barbosa and his team. We're also witnessing an increase in the rise of severe weather events, just most recently, of course, Hurricane Beryl, which unquestionably impacts health, safety, and the well-being of communities across the Americas. These global challenges make the USAID PAHO partnership even more important to promote resiliency and to advance safety, health, and well-being in the Americas. Development challenges don't exist in isolation, and neither can our efforts to address them. No agency, organization, or country can take on this work alone. So I'm really thrilled to be here today to recognize the successful partnership, which makes both of our efforts more effective and which will be all the more foundational to our work moving forward. Together, we can promote a world with strong health systems that are prepared to protect people from the threat of pandemics, address health needs throughout the course of life, and address emerging issues such as migration, climate change, and mental health. So thank you again for the opportunity to be here today. I am looking forward to learning more from all of you and for this dialogue between Dr. Gawande and Dr. Barbosa. Thank you very much.
Thank you, Michael. Let me do two things. I want to make sure the people in the room and the people virtually know that we have interpretation available into Spanish. So you shall see a knob that you can hit and use your earphones here in the room should you wish to have translation. Let me also give a special shout out to the White House National Security Council, Dr. Lisa Nelson, who has joined us here today. So we have a treat for you. I'm going to ask Drs. Barbosa and Gawande to join us in the front with Luciana Villegas for a session on looking forward together to improve health in the Americas, a dialogue between leadership of AID and the Pan American Health Organization. Thank you.
Good morning.
Good morning.
Good morning. Thank you for joining me here. I hope the microphone is working okay. Yes, Harold, give me a yes. Good morning, Dr. Barbosa.
Good morning.
It's a pleasure to have you here. My name is Luciana Villegas. I am the Public Affairs Advisor at PAHO. It's my pleasure to moderate this session today, this brief dialogue with our two high-level representatives here. We brought you here together to share perspectives and identify ways to collaborate to improve health in the Americas, especially as countries recover from inarguably the greatest health crisis in the past century, the COVID-19 pandemic. I know you don't need a lot of introduction. You are well known here, but for the benefit of our wider audience also online, I would like to start by introducing the two speakers. I'll start with Dr. Barbosa. Dr. Barbosa was elected PAHO Director in 2022 and started his tenure in 23. He's a medical doctor and epidemiologist and has a long-standing career in public health, both in Brazil, his native country, and internationally. Among others, Dr. Barbosa served as State Health Secretary in Pernambuco, Brazil, and was director of the Brazilian Health Regulatory Agency, Anvisa. He began his career at PAHO in 2007 as Director of Surveillance, Disease Prevention and Control. And prior to this current position as PAHO Director, he served as Assistant Director, leading 5 technical departments and PAHO's revolving fund, which played a key role in the distribution of vaccines to Latin America and the Caribbean during the pandemic. Dr. Atul Gawande, I hope I'm saying this correctly, is the Assistant Administrator for Global Health at the U.S. Agency for International Development, USAID, or USAID, depending who you ask. Prior to joining this Biden-Harris administration, Dr. Gawande was a practicing surgeon at the Brigham and Women's Hospital in Boston and a professor at the Harvard Medical School and Harvard T.H. Chan School of Public Health. He's the founder and was the chair of the Ariadne Labs, a joint center for health systems innovation, and of Lifebox, a nonprofit making surgery safer globally. Dr. Gawande was also a longtime staff writer for the New Yorker magazine and is the author of 4 New York Times bestselling books, including Being Mortal. Thank you both for joining. I'll stop reading now because now I don't have to remember everything that's on your bios, your very long bios. Thank you very much for your patience. I'll start with the first question. We will take a few questions from me to get the dialogue going, and then we will open the floor to the room and to the viewers online. People online can put the questions in the Q&A function of the Zoom. I'll start with a question to Dr. Barbosa as our host. Dr. Jarbas, as we reflect on how the region did or fared during the pandemic, at some point accounting for the highest numbers of cases and deaths, we recognize the many challenges that our countries face in the region of the Americas, including unequal access to services, fragile health systems. What do you believe were the most important lessons from the COVID-19 pandemic, and how can we use this to move forward?
Thank you, Luciana, and good morning. I think that's a real pleasure to be here with our colleagues from the USAID, and Dr. Gawande. Luciana, I think that the first important lesson that the pandemic told us is that nobody was really prepared to face a pandemic with the characteristics that we experience with COVID-19. So I think that it's important first to recognize that you need to rethink how we will have the countries better prepared to develop a more strong health surveillance system, how they can be more prepared to face new public health threats that maybe will not be so severe as COVID-19, but it's not predictable. So I think that it's really best to be prepared for the worst case scenario. So I think that this means that we need a better global governance. I think that it was very important to achieve an agreement during the World Health Assembly to have the many improvements in the international health regulation that will provide a better platform to exchange information, to make assessments about the risk, to guarantee transparency, and also the discussions going on the new threat accord for the pandemic. Now, this will be completed until next year. And I think that, of course, it's a member state-driven process, but this accord needs to how to respond to one of the big challenges that we had during the pandemic, how to guarantee equitable access during a public health emergency. It's not only for vaccines, but for medicines, for ventilators, for masks and gloves in the beginning of the pandemic. So I think that this is a very important part. The other one is to address the problems and the gaps that we identified in each country of the region. Of course, that in Latin America we had a huge problem that it's not easy to implement a stay-at-home policy. That was the only public health measure that you had at the beginning in countries that 50% of the economies are informal economies, that you cannot say, don't go to crowded space for a person living in a slum with thousands of people around, and that is like a crowded, permanent situation that they have with wash your hands for people that don't have access to water and sanitation. So I think that we had this social and economic background that explains a lot why Latin America was the epicenter of the pandemic for many months. But we really need to take the opportunity to improve the assessment of the capacities in each one of the countries. We need to build on some important achievements that we had. For instance, now we have 30 countries in the region that have genomic surveillance capacity. Before the pandemic, 5 years ago, talking about genomic surveillance in the region was a kind of a dream. But now in Paraguay, they have capacity. They are not only monitoring the SARS-CoV-2, but they are also analyzing viruses that have public health importance for the region, like Zika, chikungunya, and others. So I think that we had the capacity to adapt and to implement important things that now we need to build on that. And to use more assessments, external assessments of the capacities, and also to prepare better proposals for the pandemic fund and other financial mechanisms that can strengthen the capacity, providing training, ensuring better laboratory capacity, more integration with the health service, so risk communication, vaccination. So I think all the things that are around a better response. So I think that this is important because the pandemic told us that if we don't have more resilient health systems, if the primary health care cannot continue providing care during a public health emergency, countries that have good information systems, clearly we experience an excess mortality for all causes in the region, cancer, cardiovascular disease, and all. So I think that this is a kind of a comprehensive package of solutions, of alternatives that you need to implement to respond to this big challenge.
Thank you, Dr. Barbosa. Sounds like we have some opportunities too from the lessons from COVID. Dr. Gawande, what would you say, in your perspective, is the biggest lesson?
So I don't want to repeat what Dr. Barbosa said, except to say I completely agree with it, and I want to build on that. But first, I just want to thank you for being here in this building. This place has a very special place in my heart. In the mid-2000s, among my roles was directing a WHO program for patient safety. And we were working on a program that designed and then implemented the safe surgery checklist, one of my first major global projects. And we tested it in 8 cities around the world, including in the Americas. And in 2009, we unveiled the results and came out with the publication in the New England Journal showing that use of a team checklist in the operating room cut deaths by 47% where they were used. It is now in 80% of operating rooms in the world, and the introduction with PAHO was critical to the success. It came out of work we did with Ariadne Labs, but then formed a nonprofit called Lifebox with leaders across Latin America who continue to this day as anesthesiologists, nurses, and surgeons to be bringing safety and quality in surgery throughout the region. And it's been an exemplary body of work. And I just want to say my thanks to this organization for the breadth of commitment in public health in the Americas as a whole. Second, I want to say that our partnership together in COVID highlighted some of the most important investments that we have, in addition to the ones that Dr. Barbosa mentioned. I want to zero in on the last thing you began to talk about, which is the role of primary health care in this work. What we saw in the region proved to be true across the world. Where you had strong primary healthcare systems, they became the backbone of having response before vaccines were available and then after vaccines were available. And they have been the backbone for the success of virtually every public health program that we have executed on. Starting in the 1960s when USAID was founded, this was critical to the maternal child health and nutrition programs that we started with, especially in Central America, where there were major gains that came out of investing in infrastructure that brought community-based primary health care teams that could manage, at that time, very specific programs in maternal child health, malaria soon, and other programs. We demonstrated that we could move the smallpox vaccines out so that this entire region, the Americas as a whole, became the first success in eradicating smallpox. And all of that came, still, we would have found it hard to imagine we've come to where we've come now in the Americas, where Latin America as a whole has been leading the world as a region in matching equity in healthcare and life expectancy, in how long people survive. We now have the United States at a 78-year life expectancy, and we have at least half a dozen Latin American countries that now match or exceed that, with Chile and Costa Rica leading the pack and having higher life expectancy than in the United States. And those places that have succeeded have done it by investing in primary health care as their top priority. And it's very specific things in primary health care that you are achieving universal coverage of primary health care at low or free cost. Those countries that are doing it by assigning everyone in the community to a default primary health care center that they can belong to, and then that there are community health workers who provide outreach to touch every household in the community and be able to offer access when COVID came to vaccines, for example, and be able to indicate you are scheduled now for having your COVID vaccines. We had to, in the United States, we had to hire 150,000 or more community health workers in order to reach people who were not accessing the vaccine, in order to make sure people were able to have access. We couldn't get to 95% elderly vaccination without it. And the countries that throughout Latin America had those systems got there faster, got public health information out, and so on. And so I would say that there is an opportunity we have together to really build on the lessons of the countries that have been able to, at low cost, achieve higher survival, higher life expectancy than we would have expected 25, 30 years ago. Some of those lessons are this concept of empanelment, that everybody belongs to a system, that there are low costs, that there is outreach and not just good clinicians waiting for you to show up. And that allows our work. I will say that we are very proud of our partnership together, working to implement some of the lessons Dr. Barbosa talked about, including launching a couple years ago America's Health Corps as a joint effort to improve the quality and availability of the health workforce in the region by training 500,000 healthcare workers in public health and in primary health care over the course of 5 years as the plan. We, under a PAHO umbrella grant with USAID, 15,000 health workers have received training through the virtual campus for public health. And that's approximately half of the total 260,000 in health workers trained across U.S. government-supported efforts to meet the goals of the America's Health Corps. I'll finally just say, we'll get to it, but I think some of our lessons out of COVID also apply to our global health strategy, where our global health security strategy, where we're working to build that capability that has multiple important elements to make us better at preventing future outbreaks and then responding far more effectively and far more quickly when the next major epidemic comes.
Thank you, Dr. Wande. I want to come back to the U.S. Global Health Strategy, but before that, I just wanted to ask a follow-up question, Dr. Barbosa, on primary health care. Dr. Wande mentioned a low-cost, low entry point to become accessible of all people. But you have also spoken before about a revitalized, differentiated role of primary care, or expanded. Perhaps if you want to add on that.
Oh, thank you. Here at PAHO, we do believe that primary health care is the backbone of a resilient health system. And what we have been working with the countries is how we can strengthen and renew primary health care. Because when we read the Alma Ata Declaration, and it was a revolution at that time, but the epidemiological scenario when Alma Ata happened is totally different than what you have now. So this renew and strengthen primary health care needs to be able to deploy health promotion, surveillance. I think that you mentioned some very good examples that we had in Latin America, that the healthcare, primary health care and community workers were able to monitor, to provide support, to guarantee the isolation of patients at home, to deploy good information for the houses. So for this part, they are also very important, but also to respond to this very complex scenario that you have nowadays. Now, with this huge dengue fever outbreak, with millions of cases, if the primary health care is not ready to respond, we will have preventable deaths related to dengue. But also, let's remember that nowadays, non-communicable diseases are responsible for 72% of the deaths in the region. And 34% of these deaths could be prevented if a very efficient primary health care system, and we are talking about the access to training for the healthcare workers, access to medicines, to diagnosis, we could prevent around 1/3 of these deaths. But when we look to the figures, we have many challenges. Talking about non-communicable diseases, for 100 persons that have hypertension in Latin America and the Caribbean, only 50 are aware that they have hypertension, and only 25 have their hypertension controlled. So if we don't have this strong primary health care working, what we are doing, we are wasting resources, because we are treating diabetes and hypertension at secondary and tertiary levels, and at the same time, we are not being able to offer to these people the care that they need at the proper time. So I think that we are also missing a very important opportunity. So I do believe that this is the way that we are working with the countries in the region to have this very strong primary health care system.
Thank you, Dr. Barbosa. Dr. Gawande, coming back to the U.S. Global Health Security Strategy, we see now a growing recognition that health security, economic security, also climate security are interrelated and are equally important. Could you tell us a little bit more about the strategy and USAID's contribution to it?
Yes. Earlier this year, the United States launched our Global Health Security Strategy, which represents our strategy across our entire interagency of work. It's the work of the CDC, USAID, Department of Defense, State Department, everybody. And the critical components of it is recognizing that, that speed is of the essence in our ability to successfully manage and control outbreaks. Prevention is, of course, key, and a One Health approach that recognizes that most of the dangerous outbreaks originate in animals means that work that we strongly are aligned on with PAHO to strengthen our surveillance in the animal sector, along with the disease outbreaks in human beings, is critical. We see that in avian influenza and so on. And so that it starts with that core element. But the second part is to recognize that we need rapid response. In order to make both components work, we have had to recognize that we need to have cooperation at the country level in a network of countries across the world that can ensure we shrink our blind spots to the outbreaks of disease. And so although we would love to see, well, let me just say, the international health regulations are supremely important because the modifications did two things. Number one is they affirmed the standards that countries have to be able to have the capacity for surveillance and the capacity for response that would allow us to drive better prevention and detection. Second, it recognized that there is a need for investment and external donor support to help countries that aren't meeting those goals and don't have the resources to meet those goals. And then third, there is an expectation that countries will report far more quickly than occurred in COVID when there are outbreaks, and that information, specimens, tissue would be shared so that there can be quicker response. In the U.S. strategy, USAID's role has been that we are backing more than 50 countries where we are providing supportive investments in increasing the laboratory capacity, the training, infection prevention and control, the local health worker knowledge and strengthening. And some of the work I described earlier with PAHO is an essential part of that. There are 5 countries in Latin America where there are investments in the PAHO system, including in the workforce development system, to make it possible. And those come from partnerships in Brazil, Colombia, Peru, Jamaica, and the Dominican Republic. All of them are with an aim that we're lifting more and more spaces where we avoid blind spots to disease, we have faster, stronger recognition by primary healthcare workers when there are outbreaks, and third, that you then are able to mount an emergency response, bring international support where that's needed, and get the right technical assistance and guidance to bring things under control. I'll say one last thing, which is that an important part of this is recognizing how much context matters. Diseases that will break out are different from place to place. We see how deforestation in parts of the Americas is leading to more contact between wild animals and human beings. We see how there are very specific diseases such as arenaviruses and filoviruses that we don't hear much about but must be monitoring carefully, like the Machupo and Chapare virus, which have produced hemorrhagic fever outbreaks in Bolivia. We don't hear about these until they are a serious problem, and having training at the front line has to be specific to the needs and the risks in the various areas. And we're proud of the partnership that has been implementing these approaches already to become more rapid in what we're doing.
Thank you, Dr. Wande. I want to stay with the current epidemiological threats that we see in the region of the Americas. Dr. Barbosa, my question goes to you now. Avian flu. We see more and more spread to mammals. We have seen cases in birds and wildlife for the past couple of years. We see it now in farm animals. And this outbreak, of course, with the COVID experience, shows the importance of the One Health approach. Dr. Gawande also mentioned this. How is PAHO integrating this approach in its work with countries in the region, and how can it contribute to more global health security?
No, thank you, Luciana. Avian flu is I think that a public health issue that we really need to improve the response. Of course, that when we are talking about the public health threats, we can have a surprise. But the usual suspects for a pandemic is a coronavirus or a flu virus. In general, when we look to the last 20 years, and all of them came from the animal sector. So when we are talking about One Health, we really need to see how to adapt and to implement this concept in a better coordination among the animal sector, the environmental sector, and the human sector. Our member states approved a resolution 2 years ago that it was exactly asking PAHO to be more active, to work better with the other sectors. We have implemented in the region what we call quadripartite plus, because we have not only the global institution, but also the regional institution. And we have some challenges, because sometimes the private sector is not very friendly when we are talking about strengthening and sharing information, because unfortunately this can be used for competitors in the global market. So we really need to think about how to bring the private sector also to the to the table. But we have already, I think, that very good, have implemented some very good experiences. Now, here we have this multi-department working group that we bring together the human sector, animal sector, food safety, antimicrobial resistance, environmental sectors. I think that this is the kind of integration that we really need. And we have some projects. I went to Paraguay, I don't know, 1-2 months ago, and we could see in the same room all the sectors working together how to implement a project that we worked with the Ministry of Health. But it's not only the Ministry of Health. The agricultural sector was there, the environmental sector was there, the international agencies were there. So it's a kind of how we move from the concept to a very concrete action at the country level. So I think that this is the future. And this needs to start building trust and having transparency, exchange of information, and capacity to analyze the information. And for this kind of thing, having laboratory capacity and at the same time very people in the system well-trained, I think that they are crucial.
Can I build on that
Of course.
slightly? Just to say, avian influenza is so hard. This outbreak of H5N1 started more than 25 years ago. I think it was 1996 was when it originated, and it has been circulating in birds. What's changed now is that we've had these die-offs in a variety of different mammals, which makes us much more worried about it making the jump into human beings. But I think we've had a strategy that has been logical and constantly has to be revisited. But we are continuing to observe that the best way to monitor this is to continue to have surveillance in birds and poultry in particular. We have the part of what makes it hard for the industry is when we find it, you need to cull the animals, which means safely disposing of those animals and not putting those birds or the meat into circulation. But that has been a critical way to both address and see how the virus is evolving and control it. And then we have our influenza-like illness global surveillance program where we pick up when human influenza arises. And then there's a real debate and set of decisions where experts are of different opinions on how to monitor in mammals, because which mammals, it's been self-contained. There was sea lions, and then there was baby seals, and then there's alpacas, and each time it's been more contained. And so where to have the appropriate surveillance at the next level of animals is an opportunity for close collaboration as we have experts trying to come together around where the monitoring in those populations would be most successful.
Thank you very much. I'm conscious of the time, so I would like to open the floor for any questions from the audience to give everyone an opportunity to pose a question. I'm sorry, I have my back to some of you here. Gary, yes? Please say your name.
Yes, so I'll start. Thank you very much for this very interesting discussion. I'm Gerry Eikemans. I'm the director of the Department of Social and Environmental Determinants for Health Equity. I have a question around climate change. Knowing what we learned from the COVID pandemic, how a crisis affects people and doesn't affect people all in the same way. And we already see the impacts of climate change. We're suffering the heat here, but there's many other things. We see how our infrastructure doesn't survive after hurricanes, etc. And particularly, we see also that it increases the gaps between the ones that are better off, to say, and the ones who are not. So a question is, but we're also seeing that there's a lot of attention on mitigation, on reducing our outputs, but we don't see sufficient attention to adaptation. So I just wonder, what is it we can do together to put this stronger on the agenda, and particularly with this equity focus that is so needed? Thank you.
Okay, I'm happy to kick off. So many important things under the rubric of climate and health. and you summarized beautifully the needs in mitigation and in adaptation. When you take a public health approach to it, I tend to also think, what are the biggest killers that are driven by climate change, and they strongly relate to air pollution, both indoor air pollution and ambient air pollution. The work of mitigation is vital to reduce our fossil fuel outputs with that are generating the temperature changes, generating the climate change, but also generating the pollution that where air pollution claims an estimated 6 to 7 million lives a year. It is our biggest risk factor in the world for many of our NCDs, accounting for a large proportion of both child illnesses and deaths, as well as adult illnesses and deaths related to cardiovascular disease, lung disease, and even cancers. And we don't often think about the adaptation side, which is being able to have, I would argue for being able to develop graduated levels of air quality at which people need to consider wearing a mask to go outside. We saw here in Washington, D.C., during the forest fires that burned in Canada last year, air quality index getting above 400, and people finding it hard to breathe, increased emergency room admissions, and it's appropriate for us to have guidance for how to manage in ways that we can reduce those occurrences as well. I'd say similarly around extreme heat, it's not 6 to 7 million deaths. The estimates of WHO are around 250,000 deaths a year, but expected to climb much more as those levels go. And we've already seen graduated, yellow, orange, red alerts, and what behaviors are successful in reducing extreme heat deaths, which can be from heat stroke and dehydration primarily, but also extend to other components, having appropriate roofing, being able to address, school management and access to practices that successfully cool people down, and then appropriate training for health workers and being able to deal with heat levels. Finally, I'll say that there is a need. We are learning now how to, and have pretty good guidelines and now training and implementation taking place around making primary health care capacity epidemic ready. But we are less systematic about the ways we've defined how to train, how to have the guidelines and training for making primary health care climate ready, for climate catastrophe ready in particular. And I think there's a variety of ways that we can have health facilities and health workers be able to be important safe zones for people in cases of extreme heat, but also be able to address and educate people on how to stay safer when it comes to all of the other consequences, including air pollution, storm damage, and risks, and so on.
No, excellent question. I just want to add that I do believe that first we need to continue working to position health at the center of the climate change debate. I think that we have made progress with the COP last year, and you have, I think, that a very important opportunity because COP is coming to our region. So I think that this will be a very important opportunity to bring together all the efforts and to make a kind of high-level advocacy that health needs to be part of the debate about climate change. Just to add that in many countries in the region, we are working with the countries because most of them, they don't know what's the burden of disease and death related to air pollution and other climate-related events. So I think that strengthening the capacity to have this kind of information will be the first trigger to develop a system that can put in place some measures to prevent this kind of death. It's very important also that, unfortunately, also for the climate change impact, the most vulnerable population, in general, they are most vulnerable to climate change events. And finally, we are also working with the country to support them about how they can have more resilient health systems. Now, we had a very good program, with the Caribbean countries, the smart hospital that start at the beginning, it only supposed to provide more resilient hospitals, but also included the green component and another accessibility component to this hospital. And sometimes in this hurricane that unfortunately we had that produced these very, very important damages in St. Vincent and the Grenadines and Grenada, the smart hospitals and the health centers were less damaged, much less damaged, or they could be operating faster than the traditional health systems and the traditional health services. Sorry. So I think that this is a kind of a comprehensive approach that we really need to address, because sometimes even the burden of the disease and death related to climate change, they are not still perceived as a public health problem. So.
Thank you, Dr. Barbosa. We have time for one more question. If anyone from USAID. Kelly Thomas, yeah.
Can you hear me? Great. Hi, my name is Kelly Thomas. I'm with the Global Health Bureau at USAID. And my question is about Haiti. Haiti is currently experiencing a multidimensional crisis. It's impacting the public health sector, food security, water and sanitation, in addition to COVID-19 security situation and the resurgence of the cholera epidemic. It's increased the risk of other diseases, including malaria, TB, HIV, and neglected tropical diseases. And so I'm curious, how are PAHO and USAID helping to foster the resilience of the health system? And how might we deepen our collaboration to mitigate any further strain on the health system in Haiti? Thank you.
Thank you. Dr. Barbosa, I think you start now.
Yes, no, thank you for this question. Haiti is a very important issue that we really need to address as a region, because with the dramatic situation that we have experienced in Haiti in recent months, you know that the last diagnosis showed us that more than 50% of health facilities were closed in Port-au-Prince. Most of them because the healthcare workers are not feeling safe to go to the facilities. Some of these facilities didn't have electricity, so several problems. And the PAHO, working with some important partners, and USAID is one of them, we could keep the main emergency room, the Hospital de la Paix in Port-au-Prince, open and working under a very difficult situation, but providing health emergency care for these people. We also have worked together to reduce the cholera outbreak. We are not able to control and to eliminate the transmission, but the transmission is low. And I think that for this outcome, it was important working together to offer vaccines to the population. Unfortunately, we don't have the number of doses that we need in Haiti to close the gaps that we have, to implement some innovative initiatives like the motor labs, as they call, people with motorcycle that you are trained, they go to the field and they perform the test and they give the medicine. So I think that we have some lessons that we learned during this very difficult situation in Haiti. We are there. Many other UN agencies, they leave the country when the situation was very critical, but PAHO is still there. We have our technical team working with the Ministry of Health, with NGOs. We are keeping promise, that is the warehouse where we have vaccines and medicines open and running and providing critical health products to the health system. We hope that with the new government we can get, and with the, I don't know, it's the international peace force that was deployed to Haiti to support to control the violence in the cities. I think that we hope that we have more stability and to address some very important problems, as you mentioned. Maternal mortality in Haiti, that was already extremely high, almost double since the pandemic. So this is we know that Maternal mortality is a thing that a very sensitive indicator to access and to quality of care. And for some basic needs, like to not having to pay for the antenatal care in Haiti, we haven't achieved this kind of for the entire country yet. So I think that we have many challenges. We are working there, and I think that I want to thank USAID for the partnership, because this is crucial to keep health services, vaccination, the immunization program, and access to TB, HIV diagnosis, chronic disease. So to keep the health system running, at least is the minimum capacity to save lives in that country.
I'll just add, what a terrible and heartbreaking situation it is in Haiti. It's a nightmare for the health workers, our Foreign Service nationals who are working there. So many people exposed to kidnappings, fear of just traveling to get your groceries, getting your basic necessities, and the breakdown of basic public services, because in significant parts of the country, the government can't function in those settings. And so you really get to fundamental issues that are beyond the health component. And really, I'm embarrassed to even try to answer some of the questions around this, given Michael Camilleri's leadership role in the Latin America Caribbean Bureau with helping on multiple dimensions of this. But I think first and foremost is securing security. And it's so important, the multinational force. It is amazing to see that they are on the ground, the provisional government is in place, and that there's some hope. And we are seeing some stabilization that has occurred. I'd say second, on the health side, we are partnered with 170 primary health care facilities around Haiti, and they provide over 40% of the primary care for the population. So primary health care covering more than 40% of the population. And the efforts, and it's really driven by our local Foreign Service nationals that have kept those facilities open and able to maintain services, has been remarkable. Over 90% have stayed open throughout the crisis and been able to have fuel, have necessities so that they could be useful for patients and public health, and could serve the population. I'd say that we're deeply invested in and supporting addressing supply chain issues with, moving from bringing things over land to bringing things by water as safer ways, where you have cut off access to medicines and basic supplies, and then being able to navigate supporting health workers, because many health workers have left the island, and needing to make sure that we're able to enable staffing to make it happen. So it's been just heartbreaking to see the gang control come into place. People can't safely function, and the cycle of insecurity and security in Haiti has been longstanding, and yet this has seemed worse than ever seen. So it's really a combination that I think makes USAID particularly important, that it's not only what we're doing in the Global Health Bureau and the ways we're supporting our Latin America Caribbean Bureau, but the entirety of the programming that Michael and the teams are leading to bring about, if not resolution, at least improvement along the way.
Thank you very much, Dr. Gwanda. I think we could extend this for another hour if we really could, but we can't. You're very busy people, and have things to go to. I just want to close before we go, though, just with a final word. Given what we heard, we talked about primary care, epidemiological threats. In one line, what do you see as the sort of key areas moving forward? I'll start with Dr. Gwanda and then to you, Dr. Barbosa.
Our biggest opportunities around building health systems that support the workforce across the Americas. And it is essential to our transformation, including in the United States, the things that we can all do to improve our ability to respond in crisis and deliver life expectancy.
Thank you very much.
No, thank you. I just want to add that it's very important to keep our partnership strong. has been for the several years now. We expanded, we started working only on elimination of communicable diseases. That is still a challenge. Now we are talking about eliminating cervical cancer and around 30 diseases that we are working on. But at the same time, these new subjects, like the digital transformation of the health sector, like maternal health, I think that this is really a kind of adaptation of this new challenge that we have ahead of us, and I do believe that this partnership will grow stronger than it has been in the last decades. Thank you.
Thank you very much. I look forward to seeing some concrete actions. Seems you have a lot of work to do. So to all the colleagues, a very fruitful dialogue today. Thanks for the participation. Also to our viewers online. Thank you very much. Thank you, Dr. Glenn. Dr. Weber.
Thank you both for joining us in such an interesting discussion. Again, I know you're going to slip out, you're busy people, but we appreciate you spending the time with us this morning. While we have a little bit of a musical